Hi, it's Brain Bites with Dr. B. Today I'm going to talk to you about ADHD. So, a lot of this is like skill based training. So, we want to teach people how to do the thing so that they can get better at it. So, one of the cool things with kids, a lot of parents don't want to put their kids on stimulant medications, and that's totally fine. But one of the things with kids is that their brains are not developed enough to necessarily learn and implement the skills that will benefit them the most with their ADHD symptoms. So, a lot of times it's really best to treat early with stimulant medications. Kids won't fall behind in school. They'll maintain their social abilities, they'll stay confident, and they can build skills with the medication. And then as they get older, they can come off of the medication and hopefully still maintain those skills and may not need medication at all. So that's kind of an interesting thing to think about for some people that are like, oh no, meds are bad for kids. Meds are not all good for everybody. But in this instance, because the brain's not ready to learn the skills yet, sometimes it makes sense to go medication first. The nature of ADHD doesn't allow for a lot of our typical recommendations that we'll make to patients about like, oh, you need to make a list and check off your boxes and, break down your tasks and make them into smaller pieces. That's all well and good. That can be helpful, but some of the patients, because of the way that their brains work, just like I was talking about with the signals, they can't even do that. That's not part of what they are able to sort of discern and work with. So the recommendations there are not helpful for the patient. So one of the other things that can be done is you can consider what kind of functional issues they have. Like, what realm is this? Is it relationships? Is it work related? Are we talking about organizing tasks, or are we just messy and putting things everywhere? Are there different things you can train habit wise or routine wise that will make it more successful overall? One of the big things is with communication in relationships. So, an ADHD person in a relationship with a non ADHD person can be really complicated if they don't really speak the same language about what's going on. So, helping your patient or client develop some insight into what their ADHD symptoms are and what makes them a little bit different from that standpoint, and then being able to articulate that to somebody else in a relationship so that they can talk about where the issues may lie before they become a problem. Sometimes the other person in the relationship might think the ADHD person is lazy or doesn't care because they're not focused on the same things that they are. But perhaps just having some communication about what's the basic needs there and how they need to be met, that can smooth over a lot of issues where there's just not a good understanding of what's going on behind the scenes. If your clients understand the physiology behind what they do and why their brain acts the way that it does, it can help them to better troubleshoot what's going on. They can figure out their own unique ways to manage the situations. They solve the problems in some really cool ways. When I was in the Air Force, I actually ran an ADHD group. So I did prescribe medications for ADHD in the Air Force, but there are a lot of people that work in the military that have special clearance, and that clearance doesn't allow them to take certain medications. And stimulants are often on that list of medications that they can't take if they want to maintain their clearance. So I had this group, we would all get together, and the patients generally would all discuss the different things that they were struggling with, and they would talk about what they were trying to work on to help accomplish these tasks. And then they would talk to each other and see how they could troubleshoot it as a group to try to help everybody work through the same thing. This was a weekly group. So then the next week we'd check in with whoever was trying to work through something and see how it went. How successful was it? So adult ADHD can be persistent, but it doesn't have to mean long-term medications. Adults that are motivated can acquire and apply the right skills for really big positive changes. Like, this can really overhaul the way that they interact in their life and make things a lot easier and more functional. Stimulant treatment can be very expensive, and getting treated for ADHD can be very time consuming. Not all psychiatrists prescribe stimulant medications. I do not prescribe stimulant medications in my practice. I don't prescribe any controlled medications at all. So I do not prescribe Adderall or Ritalin or Concerta. I do prescribe some of the non-stimulant ADHD medications, and we do work on skills. There are a lot of psychiatrists out there who do treat ADHD, and there are some clinics that that's what they specialize in. It is good, though, to let your client know before they go seeking ADHD treatment that they should look into the clinic that they're going to. Some clinics will require multiple visits. They will do pretty thorough assessments and then have patients come back at separate times to get the results, to make the treatment plans. The medications may only be given in 1 month supplies, which is standard for controlled substances. And then patients often will have to go and get drug tested before they get their next refill of medication. So that can be costly and time consuming. But if your patient benefits from these medications and this is what they have to do to get them, then I fully support that. But it is good before a patient dives into this ADHD treatment, if their primary care doctor is not providing the stimulants or they're not getting it from their regular psychiatrist, it can be a bit difficult to get it all set up. The other thing with medications is they only work if they get taken. So if somebody has trouble even remembering to take the medications, that can become a problem. Picking up refills can become a problem. Mail order is great for this because it will show up at the door. But there are a lot of hurdles for ADHD patients that we may not think of if we don't come from that world. So if your brain is neurotypical, you may not think of all the other things that could impede an ADHD brain from being able to do the things it needs to do to function better. So not everyone who has trouble concentrating has ADHD, but they might. So ADHD brains are different. Neurotypical answers won't always work well here. And just like always, everything requires an individual approach. Hopefully this little brain bite on ADHD and how it can be diagnosed and treated, what causes the problems in the first place, has been helpful. Enjoy.